Have you ever wondered what the difference is between a pediatric sleep consultant, a child sleep consultant, and a holistic child sleep consultant? Recently, we've been receiving this question from parents quite a bit, and the answer may surprise you. First, let's talk about the term pediatric. You see, the word pediatric simply means relating to children. And what many parents don't realize is that the title pediatric sleep consultant doesn't automatically mean that the person is a pediatrician, a physician, a nurse practitioner, or a licensed healthcare provider. In fact, in most cases, a pediatric sleep consultant and a child sleep consultant are essentially the same profession. The difference is often the title chosen by the certification program or training organization. Now, that doesn't mean that one is better or worse than the other. The real question that benefits parents isn't, are they pediatric? The real question that benefits parents is, what training have they completed and how do they approach sleep? Because that's where the biggest differences begin to emerge. You see, some sleep consultants primarily focus on behavioral sleep strategies. Their work may center around schedules, routines, sleep associations, independent sleep skills, and behavioral interventions. And while these approaches can be helpful for some families, they may not extensively evaluate the broader factors that could be contributing to sleep challenges, or they may not spend significant time exploring the physical, emotional, developmental, environmental, and family influences that may be impacting sleep. For many families, that might be exactly what they're looking for or what they believe they're looking for. However, there's another approach that many parents may not be aware of. A holistic child sleep consultant goes beyond behavior and asks a deeper question. Why is this sleep challenge happening in the first place? Because if we look at the definition of behavior, behavior is simply the way a person responds or reacts to internal and external influences. In other words, behavior is the response. So when a child is waking frequently, resisting bedtime, struggling with naps, or having difficulty settling, a holistic child sleep consultant doesn't just ask, how do we change the behavior? They also ask, what might be contributing to that behavior? The goal isn't simply to change behavior. The goal is to better understand what's driving the behavior so we can better understand the whole child and the whole family, and as a result, support can be more individualized, comprehensive, and responsive to their unique circumstances.